Hi, I'm Dr. James Bixler, and I'm a psychologist here at Mayfield. And today I'm here to talk to you a little bit more in depth about psychological evaluation. This is a topic we've touched on before here. And so I think it's important to note that one of the things I'm going to try to focus in on is specifically psychological evaluation. There's about three different kinds of assessments, broad categories of assessment that you might be sent for by a mental health professional. And the first one's neuropsychological assessment. And those are typically aimed at things that are directly related to your brain development, such as ADHD, autism, and or brain injuries such as concussions or TBIs, and the effects of those things on your brain. And the second category would be more around educational or academic impairment or excellence. So anything that has to do with learning disability and or possible gifted and talented areas. And that would be assessments of ability and achievement. And then there's psychological evaluation. And that's what I really want to talk about today. Oftentimes your therapist might say, hey, I'd really like to send you for a psychological evaluation. And that can sound really intimidating. Some of our first questions can be like, oh my gosh, why? What's wrong with me? I kind of want to assure people here that typically when that's sent or said by your therapist, it's not specifically that something is deeply wrong with you. Typically, it's because the therapist has come to awareness that perhaps you are unsure of exactly what's happening with you, and they are unsure exactly what's happening with you. And so they'll say, hey, let's get an assessment because that will probably much better inform you and much better inform me about what is happening with you psychologically, why you might be having some unusual experiences, or why you might be having this certain kind of presentation of this anxiety that you've never had before that is really distressing to you. We really want to aim at figuring out what is going to be most effective in helping you. And if you really don't understand what's going on with you, and your therapist really doesn't understand what's going on with you, it's hard to pick out the best kind of treatment. So I think that's the main value of psychological assessment is how can we mediate? How can we intervene? How can we help understand exactly what's happening? It's not an exact science, but it's probably more accurate than people know. Good psychological assessment really can inform us a lot of different things about the specificity of what's happening with you, where it might be coming from, and what might be best to help. And so I think some people get intimidated when somebody says, hey, there's a lot going on. You don't have maybe a clear idea of why or what. I don't have a clear idea of why or what, or maybe it could be one of 4 or 5 different things. And how we treat those 4 or 5 different things are very different. And so I would really like to kind of hone in on what the most likely scenario is for you. And so we'll send you for psychological assessment. You'll probably go see a psychologist or psychologist group who might use test administrators and then have the psychologist do the interview and evaluation of the testing data. A lot of people want to know, well, what do I need to do to prepare for something like that? I think the answer is put yourself in a mindset where you're just going to answer as honestly and truthfully as you possibly can. Listen to your assessor and what they're specifically asking you to do. So they might ask you to answer an assessment of, answer all these questions about your experiences in the last 30 days. Or they might say, answer this assessment in a full, like, how have things been for you over the course of your life? You really want to pay attention to that and set your intention to answering as honestly given that criteria as possible. Be frank with yourself. Be as real and genuine as you can be. Trust yourself about what the answer is to the questions that are asked. I think that's really important for us to get a really good sense of what specifically is happening with you. I think it's okay to be nervous. I think to say, oh, well, don't be nervous at all. That's a little disingenuous. Uh, I think what I would say is you're there for a reason. I hope that you've been with a therapist who you trust. I hope that you've trusted them enough to say, hey, this is a referral that I think will really help you. And trust that process with your therapist. If you have a good therapeutic relationship with your therapist and they've sent you for a psychological evaluation, I would encourage you to trust the process. Again, remember that going back to that main goal is to find the right things to create clarity for you, for your therapist, for the therapeutic process, and what's going to be the most helpful to you. A lot of people will come in having some really unusual experiences. What do I mean by that? They'll have experiences that they're like, okay, I don't think other people that I know are having this kind of thing happen. And that can be everything from, wow, I feel like my attention is so bad, I can't focus in ways to get my job done. Or I'm having a physiological reaction that's so severe, it stops me from being able to work or go in public. Or it'll just kind of hit me out of the blue and I just can't continue to do what I was doing. Maybe I have to get up and leave a test that I was taking in school, or maybe I have to sort of get out of where I'm at. And that's coming with a lot of shame because I know people are noticing. It might even be, hey, I'm having some perceptual experiences that other people don't experience, or I feel like I have this thing where I'm not with my body. All of those things are symptoms that are well understood and are really well clarified by psychological evaluation. So we can help bring you clarity around some of those patterns in your life, or some of those recurring things, or some of those single instances that may be making you feel out of control or really depressed or heightening your anxiety or the other things that you really want to work on in therapy. And without really understanding that, you're having a hard time making the progress you want to make. So let's talk a little bit about what you might expect when you go for a psychological evaluation. I think it's really important to note that this is not like a academic evaluation. It's not like a vocational review. This isn't something you pass or fail. Okay. This is something that tells us, hopefully, and tells you, hopefully, what is going on with me that I'm struggling to understand. So I think that's really important to know. I think a lot of people can go into these things and think, how do I make sure I pass this? That's not what we're doing. We're trying to get a sense of what's happening with you. Then kind of where the rubber meets the road. You're probably going to sit one-on-one with somebody, and there's a couple of different things you might experience. You might experience some of the assessments be what we call self-report. So you get a sheet with a lot of questions on them, and you answer the questions to the best of your ability. Probably your evaluator will sit with you in case you have questions about any of the questions. Probably what they'll tell you is, well, how do you understand that? How would you answer that? Maybe they'll give you a little bit more clarification than that if there's some real genuine confusion. But those go pretty well typically. They're just self-report and there's not a lot to be nervous about there. You will probably experience what we call some sort of clinical interview. It might be a structured interview or a more free-form interview. What's the difference? One is a structured interview. Your evaluator is going to ask you a series of set questions. Okay. A more semi-formal or unstructured interview, they're going to be just interviewing you in general to ask questions related to why you've been referred to them. That are going to be set the stage and context for them to help better understand things that you're self-reporting, okay, on the other evaluations they might give you. And then finally, you might experience what we call a more interactive projective assessment, which might be, hey, I want to show you a picture and I want you to tell me a story about the picture. Or, hey, what do you see in this picture? Or, hey, I'd like you to draw or play with some blocks or do some different kinds of tasks. Uh, I think those actually are probably the thing that makes people the most nervous because they feel the least clear. I think that's okay. Those are also sometimes a little more comfortable because they're a little more interactive. The therapist will probably be a little bit more interactive with you during that time. And I think with things like that, again, what they're really mostly helping us do is set kind of a deeper level of context of how do you respond to certain things? What's your typical ways of interacting? How do you view the world? And that kind of context is really important as well when we kind of try to think about what all the data that we're gathering says. I think the other thing is typically a psych evaluation or a psychological evaluation. Um, It'll either be brief, moderate, or more in depth. And so a brief psych evaluation might be a brief clinical interview along with some self-reports, probably gonna last an hour and a half to 2 hours. Something deeper than that, where they give you some self-report measures, some things like that, might last 4 to 5 hours. And then probably something more in depth might take place over the course of a full day, or even over the course of 2 days and several rounds of interviews. The interviewer might, or the psychologist might ask to do a follow-up interview with you to clarify some information. They might ask to interview some other people in your life that have come up as significant figures. If you were open to that, you don't have to be open to that, but if you're open to that, a really more in-depth psychological evaluation might try to gather perspectives from other people to try to give you a clearer picture of what's happening. At the end, the psychologist will probably take all that data, not probably, they should take all that data and compile it and really work to interpret it in context of one another and what you've presented to them. They're going to take the time to write a report, and then they should take the time to deliver that report to you and give you some time to both have them talk to you about their findings and give you the opportunity to ask questions. That's a really important thing I want people to be open to when they go into that final piece. I think sometimes that can feel like drinking from the fire hose. This person that you've only spent 2 to 10 hours with is suddenly telling you all kinds of things that feel really personal and feel really like, wow, how does that seems right for me, or that seems wrong for me, or what's going on with that? And it can feel like drinking from the fire hose. And then at the end, when your assessor says, hey, do you have any questions about the report? A lot of people just are like, no, because they're digesting. So there's 2 ways to handle that. One, I think, is to have the question in your back pocket of, hey, that felt really overwhelming to me. I would like to digest that. Is there a time that we could set up for me to ask questions to you? I think that's a fair ask. I think the other thing that you can do is bring a notepad and write questions down or take notes as they're talking to you so that you can go back through them at the end and make sure that you ask questions. Psychological evaluation is really effective, but again, its purpose is to help bring clarity to you. And if it is not bringing clarity to you, its primary purpose is not being met. Okay? If it's not bringing clarity to you or your therapist. The other thing sometimes people will do, and I ask, as I do psychological evaluations for people, particularly more in depth, if their therapist has referred them, I will ask the client, I would ask you if you would be willing to have your therapist sit in on the feedback session. That can be really useful. So that sometimes your therapist can help you ask the questions you're feeling a little overwhelmed to ask. Because again, the idea here is to create a direction for you that is actually going to help when you and your treatment team feel like somewhat out of a loss of like what exact direction we should go that's going to be the most helpful. I hope that's helpful and dispels some of the anxiety. I get that not all of the anxiety is going to be dispelled for anyone when they go into a situation like this, but it's not supposed to create mystery. It's supposed to create clarity.